Hey there, this is Dr. Evan Osar, developer of the Integrative Movement System. Welcome to video 3 of this 3-part video series of training the older client with spinal conditions such as degenerative joint disease, degenerative disc disease, and or spinal stenosis. Recall from the first 2 videos, so if you missed them, make sure you check those out before watching this video. That our primary goal when working with older clients that have any kind of spinal conditions, once they've been cleared to exercise, is to help them establish a more effective strategy. One of those strategies is to help them use their hips better so they don't have to preferentially move through their spine for every single motion. Of course, we should have some spinal motion, but too many of our clients lose the ability to use hip motion, and then they make that up for the low back, and it's ultimately what starts driving a lot of low back dysfunction. So in our last video, we looked at the hip hinge pattern, which is one of our go-to patterns for helping our clients create more pure hip hinge or anterior pelvic motion or anterior pelvic rotation of the pelvis over top of the femoral heads. And that's a key pattern for helping load the posterior hip, for helping them bend down in everyday life, to pick things off the floor and to ultimately move their body in a forward manner without overloading the trunk and spine. In this video, we're going to talk about hip rotation. Now we're going to assume that we've done our manual therapy work, so our soft tissue work, manual therapy, trigger point work, to help release whatever's tight around the hips. Could be the hip rotators, could be the posterior fibers or the superficial fibers of the glute max, could be the hamstrings, whichever muscles are compressing the hip and restricting hip rotation. Once we've done that, one of our go-to patterns for teaching hip dissociation, especially in that transverse plane or rotation, is the split stance pelvic rotation pattern. So what we do with this is the same idea. We align the spine to the best of our client's ability. We'll have them place their hands upon their pelvis. So most of the weight will be on their forward leg, but again, they're in a position where they can be most stable, where they're not going to lose their balance. They place their hands upon their pelvis, and what we want to do is teach them how to rotate their pelvis around their femoral head, to move the pelvis independent of their hip, because it's ultimately what we need to be doing, what they need to be doing when they're walking. And that's oftentimes why many of our older clients tend to waddle, because they don't have the ability to rotate through the transverse plane, so they will waddle, or they'll start to move excessively through their knee. And that's where a lot of valgus knee problems come from, because they're not moving through their hips, so they start creating frontal or transverse plane motion on or through other joints to make up for the lack of hip rotation. So, align the spine to the best of your client's ability. Place the hands upon the pelvis. They'll take a deep breath in, and as they breathe out, I want them to rotate their pelvis towards their forward leg without moving the lower extremity. So their lower extremity stays aligned, hip, knee, ankle, foot, and they're rotating the pelvis around their lower extremity. They'll come back to center and then rotate away. Again, making sure that kneecap or that lower extremity stays aligned. The kneecap should stay facing towards you if you're standing in front of your client. So that way they start to learn that, yes, they can move that pelvis around the femoral head, because many of our clients don't have a good ability or awareness to create this movement. So we'll do 5 repetitions in each direction. And again, we have the client go slow so they can really see the true motion they have between the pelvis and the femoral head. Then we switch sides, same idea, rotate that pelvis independent of the leg. Do not allow that kneecap or that knee to move into valgus position or to rotate through the knee as they're going through this pattern. And you'll see that many of our clients have very limited ability to move the pelvis or move the hip independently, the femoral head independently of the pelvis. So really excellent pattern, and a pattern we use with all our older clients as well as all of our runners, because that's essentially what our runners should be doing. Because then this pattern or this ability to move the hips sets up our rotation patterns. So our core patterns of how we'll then go into training the core in clients with spinal conditions. Because we want to teach them again where that long spine position is, how to stack up the thoracolpelvic cylinder, and now what we want them to be able to do is rotate around their femoral head. So again, they're moving their entire thoracolpelvic cylinder, but again, moving that pelvis around the femoral head, and then coming back and controlling. Moving around the femoral head, coming back, controlling. So all these core chopping and rotation type patterns come from the ability to move that pelvis independently of the femoral head. So whether you're chopping or rotating towards the machine and or away, we're creating pure hip rotation loading the core in a very safe manner for clients that have spinal conditions and respecting the motion from and around the hips. So this is Dr. Evan Osar with Integrative Movement Insider. I hope you enjoyed this 3-part series, and this is ultimately what we teach as part of our Integrative Corrective Exercise Instructor program, especially for those individuals like you that work with older clients like we do. So if you want to learn more information, check out the link below this video. Hope to see you at a course soon. Hope this video helped serve you and your clients. Thanks for watching. Take care, and we'll catch you next time. We're going to be in several locations starting this February, bringing the Integrative Corrective Exercise Instructor program regarding training the older adult. And this program is very specific to those of you that work with older clients like we do. We're going to be sharing with you the assessments and the corrective exercise strategies, the strategies for success that we use with our own general population clients, especially those older adults. We'll teach you how to take these concepts and integrate them into the fundamental movement patterns that you're already using with success with your own older adult clients. So you become that specialist they need, they want, and your potential clients will seek out to help them successfully achieve their specific health and fitness goals. So if you're looking for more information, click on the link below, and I'll see you in videos 2 and 3. Take care.